Welcome back for the final and the last video, 9th video, and I had already been discussing about this video for quite some time now. So this video is for those who may not be able to qualify NEET. Now, for a matter of fact, you have to understand that 24 lakh students will sit for the exam. In that, 12 lakhs will qualify this year. So another 12 lakhs will definitely not qualify. This is the truth. But that does not mean that these 12 lakh who do not qualify when actually do not want to become a doctor, correct? That cannot be said. So although it may happen that due to some physical reason, some problem for that particular day, the student was unable to perform at his or her best, or due to any reason. Okay, so I understand that there will be some who will simply appear for NEET UG just for fun. That is okay. But those who appeared NEET UG to become a doctor but could not qualify NEET, what options do we have? Correct. Now, as of now, you understood that only once you qualify NEET, at least to the general cutoff or the reserve cutoff, you stand a chance in India. Now, what if I say that there is still an option to become doctor? Actually, two options to become a doctor in India without even appearing NEET. Okay. So that is, you can become a doctor in you have two choices actually. One is through physiotherapy and one is through pharmaceuticals. Okay. Now, don't immediately close the video just by hearing this. Listen to me. If it makes sense, then you can later on curse me or whatever you can tell me. Okay. So see, physiotherapy is actually a medicine science which is not internal medicine, it is external medicine. It is all about bones and their joints and how to treat a patient without giving the medication or surgery. It is a very upcoming next thing, or it is already present. You will always see that when you are watching cricket, you will see if a player gets injured, immediately a physician runs to him to either wrap him or give him sprays and see what is the problem, correct? In football also you have seen. So who are these? They are not general medicine. They are MPTs, Master in Physiotherapies, who have the skills of various bones and locomotory problems, and they treat the patient just based on that. Okay. And they are highly reputed, highly sought after, because see, most of us, you might know that most of us or your parents, they fear surgeries, correct? So what if for one particular problem there is a way where without doing surgery you can get treated, correct? For example, say there is something called as ankylosing spondylitis, where the spine of a body becomes so stiff that a patient can't move his or her body. Okay. So that again, if it is diagnosed earlier, can be very easily treated through a physiotherapist, okay, who knows that what he is going to do. At the same time, if he goes to a regular surgeon, the surgeon will obviously advise him to go for surgery, correct? Now, a patient who do not want to go for surgery, what he or she will do? Because surgery not only makes a person to cut open his body, but also costs a lot of money. So what a person or a patient would do, they will choose to come to a MPT or a physiotherapist to get a treatment without getting a surgery done and in lesser cost. So a physiotherapist, a B.P.T, and then a B.P.T followed by an MPT is a very rewarding career in itself, and end of the day you are also a doctor. You are allowed to put doctor in front of your name after completing your B.P.T degree itself, correct? So B.P.T and MPT is a very well-known alternative which you can also explore just in case you do not qualify NEET, or although sometimes even if you do not want to appear NEET, if you have watched this video and still you feel interested, you can always reach back to us and we can guide you to become a B.P.T or an MPT in very reputed colleges, and also these courses are taught in medical colleges itself. So you are not deprived of anything. You are studying in a medical college, you are going in a hospital for your internship. It's a 4-year course, so 4 year will be your classroom teaching along with practicals, and half year will be a mandatory rotatory internship in the hospital only, correct. So this itself will give you exposure to patients, and you will handle patients, you will prescribe medication in the sense the exercises, what the patient should do, and you will also do the medicinal training. Like there are some medicinal training where you give ultrasound therapy, you give heat bag therapy, like that. So these all can be done by a physiotherapist, correct. So this itself is a very reputed course and a reputed career option that you have without even appearing NEET. So think on this, and if you have any doubt, definitely get back to us and we will be happy to clarify you. Okay. Now, physiotherapy, B.P.T, MPT, okay, 4.5 years course. Apart from these, pharmaceuticals, you have another option. Okay. So first, you have to understand one thing. When we fall sick, we go to a doctor, a general medicine doctor, who prescribes us a medicine, correct. Now, say for example, I have fever, a general medicine will prescribe me a tablet, say paracetamol. Okay. Now, have you ever thought that from where did this paracetamol come into? Now you might think, okay, it will come from the pharmacy. That's okay, but the doctor who gave you that, prescribed that medicine, he did not formulate the medicine, correct. So there has to be a person who has done the formulation of paracetamol, where active ingredients are there which will go inside our body and fight against the foreign agents that have gone in and has made us ill, correct. For stomach upsets, we have separate medicine. For everything, we have either oral drops or injections or medication. But the point to ponder is, for each of these medicine, someone has to discover these, research these, and find out this medicine, which then are being dispensed by a certified doctor. So who does this research of medicines, correct? These are done by Pharm or Doctorate of Pharmacy. This course is a very reputed, well-known course in the USA, which is now being taught in India as well. It is very similar to MBBS course structure, where 6 years of education has to be completed and 1 year of 1 year internship, including the 6 years, will be there for that Pharm student. Okay. So even if you see the curriculum also makes the Pharm students study human anatomy, human biochemistry, human physiology, etc. So it is very similar in the part of the curriculum, theoretical part. In the practical part or the clinical rounds, the only thing that differentiates a Pharm and the MBBS graduate is, MBBS graduate will go towards diagnosing a patient's problem and prescribe him medicine such that the problem gets resolved. Okay. Whereas a Pharm student will go to the same hospital, talk to the same patient, but this time he will be observing the dosage that is given to the patient, what are the alternate medications that can be given to the patient, what are the options that patient has in terms of overall healthcare, say, because some medication may create some other problems in the patient, existing patient. So what alternative medication can be given to patient, such thing, or if in case there is some problem where existing medications have failed to treat that patient, then what new medication can be researched, that everything is taken care by Pharm. Okay. Pharm, then there are other specialties also, like microbiologist and virologist will also be there, but Pharm plays a major role in identifying and researching those medications. Okay. So this Doctorate of Pharm or Pharm course is actually very popular in USA, where USA students, they study that and become clinical pharmacists. Okay. In particularly in USA, the medication system is quite different from India. In India, we visit a doctor, he or she only diagnoses our problem and he or she only then prescribes the medication for us, which we go to a pharmacy, buy the medicine and consume, correct. But in USA, a MD doctor will diagnose a patient, but he or she will not prescribe a medicine to him directly. Instead, he will only diagnose the problem and give a sheet to the patient. The patient has then has to go to a pharmacy and visit a clinical pharmacist. A clinical pharmacist is a person who then, based on that diagnosis, will prescribe medication for that patient. Okay. Hence, in USA, a MD doctor and clinical pharmacist are equivalent. They get same pay structure, same salary, everything. Hence, they are very much respected in USA, Canada, and other developed nations. So, hence, for PharmD, earlier students used to travel from India to USA and go for a lengthy process of examinations and other certifications to become a PharmD. That process was very long time used to take. That course had been introduced in India, and it has been running successfully for last many years. So, a student enrolls for PharmD here in India, completes his or her 6 years, and then after that he or she can choose either to become a clinical pharmacist and goes to USA, or he can choose to join pharmaceutical industries in India or other healthcare industries in India, where they go for research of medicines and help the pharmaceutical company to explore new options of medicines for existing or non-existing diseases, and thereby they also become a very respected doctors in India. And by the way, by studying doctor of pharmacy, by rule you can also put the word doctor in front of your name. So, you are not deprived of anything that you will otherwise miss out while studying MBBS, correct? Hence, PharmD is one of the biggest, one of the best alternative to MBBS that exists in India, and you can choose to study PharmD in India in respective medical colleges itself. You name it, they have it. All medical colleges in India, in particular in South India, has PharmD. Ramaiah has, JSS University Mysore has, the Anand Sagar has. So, you see, Kasturba Manipal has. So, wherever you choose to study MBBS, exactly that same medical college and hospital, PharmD is also there. Okay, but the way of admission is different. So, for that, if you are interested, you can contact us and we will be happy to help you and give you further details. For the scope of this video, we have only kept it in the short and as an introduction, so that if interest arises in you, you can always get back to us and we can then take you to the further we can explore and we can help you understand how you can get admission for PharmD courses as well. Okay, and before I end, even a PharmD student can go and practice medicine like MBBS student. After they have completed the PharmD, they can go to USA, Canada and Russia, where they have to appear for another set of exams and another set of education, particularly in Russia, where they can enroll for MD courses like general medicine. They can enroll for those courses in Russia. They can study there, complete it and then come back to India and practice as a MBBS doctor only. Okay, that is allowed. So, although the path will be little longer than a standard MBBS, but it end of the day you can if you wish to. Otherwise, you also have alternative ways where you can earn equivalent or more than a MBBS MD doctor by getting an employment in a pharmaceutical company, where you are becoming a research head, you become a research scientist, and you go on in doing PhDs and all, correct? So, PharmD is a very good alternative. However, seats in India are comparatively very limited to even MBBS seats. Okay, MBBS seats are itself lesser. PharmD seats are comparatively lesser than MBBS seats. So, if you have some interest or you do some research on you and you want to know more, always connect with us and we will be happy to help you and guide you with PharmD course as well. And this is being the second alternative for students who failed to qualify NEET, or who for some reason could not qualify NEET, or who did not even attempt NEET. They still can study in India and become a doctor. And by the way, for PharmD, there is very interesting thing. Even students with physics, mathematics and chemistry, as well as physics, chemistry and biology, both the students are eligible for PharmD. So, this particular course also opens doors for students who are non-biology background. Okay, and if this is a very interesting fact, I will like you to share it with your friend who has not studied biology but is keen to get into healthcare education. Okay, please do share, because this will, if it doesn't help you, it will help someone else. Correct? So with this, I'll conclude this video, and I think this series has been an entertaining series where you have understood the medical admission scenario in India, the types of medical colleges, the counseling, how it happens, and what happens when you score high, what happens when you score low, and what happens when you may not get a qualification mark in NEET. But still, if you have a MBBS dream, or not MBBS, sorry, if you have a dream of a doctor, then understand that we are there to help you to achieve that dream. Just connect with us, and we'll be happy to help you further in whichever way you want us to, be it in MBBS, be it in physiotherapy, be it in Ayush, be it in Pharm, in any of the courses, we are happy to help. I am Sunando Das, and I am signing off from Admission Square Consultancy from Bangalore, and we'll be happy to meet you personally over the Zoom calls or over phone, and we'll extend our services to you. Till then, take care, all the best for NEET, and bye.